Monlica Healthcare is proud to present the Brennan Skin Graft Mesher, one of the most dependable, durable, and highly regarded mechanisms for the expansion of skin grafts for a variety of surgical procedures. The Brennan Skin Graft Mesher is totally self-contained and eliminates the need for disposable parts such as plastic carriers and rolling pins. It saves time and the cost of ordering and maintaining disposable components. There are no user-serviceable parts, just normal cleaning, lubrication, and sterilization are all that is required for continuous trouble-free operation. Let's take a moment to review the best maintenance methods to ensure long-term use of the mesher. First, carefully lift the mesher from its container. Be careful, the mesher weighs 13.5 pounds. That weight provides stability and durability during use in the surgical space. You want to be careful not to slam or drop the mesher on its handles, which could cause damage to the inner workings of the mesher. Step 1. Detach the faceplate and remove the 3 screws below using a Phillips screwdriver. Next, detach the rear plate comb by loosening the 2 thumb screws under the unit and pull the rear plate comb up and back to remove. Step 3. Detach the stainless steel weighted base underneath the mesher by removing the 2 machine screws using a hex wrench. You can then rotate the mesher using the ratchet lever when gently washing and rinsing. Also, use a soft bristle cleaning brush to aid in the cleaning of the plates and the rollers. We strongly recommend that you do not use metal forceps or a metal brush when cleaning any portion of the mesher, as this might mar the stainless steel finish and cause damage to the rollers. Once you are through cleaning and prior to reassembly, place a drop of mineral oil into the 3 faceplate screw holes and the 2 weighted base screw holes. Reassemble the mesher by reattaching the faceplate and the weighted base. To correctly position the rear comb plate, insert the plate at a 45-degree angle until the rear comb plate's teeth match up with the lower meshing roller. Carefully lower the rear comb plate until the alignment pin on the frame enters the slotted hole on the underside of the rear comb plate. Then, hand tighten thumb screws. To ensure the comb is fully secure, attempt to move the comb with your fingers. If the plate moves at all or makes a slight clicking sound, you should loosen the thumb screws and try again. If the comb remains loose or out of alignment for a grafting procedure, the skin graft could get caught in the mesher and might become damaged. The Brennan Skin Graft Mesher should be lubricated with 3 to 4 drops of mineral oil, placed in each of the 2 oil holes located at the top left and right of the handles. After the mesher is wiped clean, it should be placed back into its carrying box, and it will then be ready for sterilization. The Brennan Skin Graft Mesher may be autoclaved using a standard gravity sterilizer or a high-speed flash sterilizer. Dry heat sterilization or gas sterilization can be substituted according to your normal sterilization procedure. Do not attempt to use the mesher until it is thoroughly cooled. The instrument may be cooled more rapidly by immersion in room temperature or cool sterile water. The Brennan Skin Graft Mesher is available in 6 mesh ratios: pie crust, 1:1, 2:1, 3:1, 4:1, and 6:1. A meshed skin graft will be fully expanded when the interstices form a square or diamond pattern. Since donor skin contracts when removed with a dermatome, the actual expansion may appear less than anticipated. This should be taken into consideration when calculating the amount of donor skin needed to cover a wound. Thank you for using the Brennan Skin Graft Mesher. For information regarding repair or warranty work, please contact Monlica Healthcare Customer Service at 1-800-843-8479 or customer.orders@monlica.com.
When a patient's wound needs the extra antimicrobial power of silver, Mepilex AG is the dressing of choice. Mepilex AG is an antimicrobial soft silicone foam dressing that absorbs exudate and maintains a moist wound environment. The SafeTac silicone layer does not adhere to the moist wound bed, only to dry tissue, and provides less pain and trauma to the patient during dressing changes. Mepilex AG begins inactivating common wound-related pathogens within 30 minutes of application and has an effective sustained release of silver for up to 7 days. By reducing the number of microorganisms in the wound, Mepilex AG may also reduce odor. Mepilex AG is designed for a wide range of exuding wounds, such as lower extremity ulcers, pressure ulcers, and partial thickness burns or other injuries. Mepilex AG is also an ideal choice for donor sites when the addition of an antimicrobial dressing is desired. It may be used under compression bandages and can be cut to suit various wound shapes and locations. To apply Mepilex AG, cleanse the wound area and dry the surrounding skin. Use release films for handling during application. Apply the adherent side to the wound and do not stretch. Mepilex AG should overlap the wound bed by at least 2 centimeters onto the surrounding skin. Hold Mepilex AG securely in place with a light bandage or other dressing fixation or retention product, such as MeFix, Mepitac, MePore Film, or Tubifast.
This is an overview of the skin, wound, and Mepilex AG with the SafeTac soft silicone layer. Wound fluid is absorbed into the dressing from the wound bed through the SafeTac layer. The absorbent foam is impregnated with silver sulfate particles. In this dry environment, no silver ions are released. When fluid is absorbed into the foam, it comes into contact with the silver sulfate particles, and silver ions are released into the fluid. The mode of action of silver is due to the silver ion. When the silver ions, Ag+, come into contact with the bacteria, they have an antimicrobial effect on microorganisms. The antimicrobial mode of action of silver can be explained in 3 ways. First of all, cell wall rupture. When Ag+ binds to proteins in the cell wall could break and the contents of the cell could leak out, resulting in the death of the bacterial cell. Secondly, Ag+ might also bind to bacterial enzymes, resulting in the inability of the bacterial cell to perform processes necessary for respiration, or to take in or process nutrients. What's more, the silver ions disturb replication. Ag+ might bind to bacterial cell DNA and interfere with cell division and the replication process. Silver ions in the fluid will strive for equilibrium and thereby divide homogeneously in the wound fluid, both inside and under the dressing. As a result, the silver ions will also be released to the wound.
If your patient's wounds require a highly absorbent antimicrobial dressing, then try Monlica Healthcare's Melgizorb AG. Tests show Melgizorb AG absorbs up to 45% more exudate than the leading silver hydrofiber dressing. It has a sustained antimicrobial effect for up to 14 days thanks to the power of ionic silver. The superior wet strength of the alginate fibers decreases the chance of disintegration of the dressing in the wound bed, so it can be removed easily and all in one piece. For deep, highly exuding cavity wounds at risk of infection, Melgizorb AG is designed to outperform the competition. Melgizorb AG ensures superior exudate management, easy dressing removal in one piece, and of course, sustained antimicrobial activity. Melgizorb AG releases silver ions into the dressing upon the presence of wound fluid. That activity protects the dressing from a broad variety of microorganisms for up to a period of 14 days. During that time, Melgizorb AG is an effective barrier to bacterial penetration and protects the wound, while also aiding in autolytic debridement and helping to promote wound healing. Melgizorb AG is suitable for use on moderately to heavily exuding partial to full thickness chronic and acute wounds that are critically colonized or at risk for infection. Areas of use include leg ulcers, pressure ulcers, venous and arterial ulcers, diabetic neuropathic ulcers, graft and donor sites, surgical wounds, and trauma injuries. Melgizorb AG can also be used under compression bandages. A wide range of sizes offer appropriate dressings for wounds of nearly all shapes and sizes. Wounds with an increased bacterial load or infected wounds are painful. That's why Monlika Healthcare has extended the range of its pain-minimizing antimicrobial dressing with a new dressing, Mepilex Border AG. Our all-in-one absorbent dressing also includes Monlika's exclusive patented SafeTac technology that minimizes pain to patients and less trauma to wounds upon removal. Mepilex Border AG features exceptional exudate management for medium to high exuding wounds. Together with the enhanced conformability of Mepilex AG, the antimicrobial range offers targeted performance for a wide variety of wounds and situations. Mepilex Border AG is designed for patients whose wounds show signs of rising bacterial influence and are at risk of local wound infection. The key to the effectiveness of Mepilex Border AG is the power of silver, which acts as a protective barrier against wound-complicating pathogens. Mepilex Border AG offers unique benefits in wound care management. Our collection of dressings are easy to handle, apply, and remove, and do not stick to the moist wound bed. They are comfortable for the patient and minimize trauma and pain thanks to our exclusive SafeTac technology. Mepilex Border AG also seals around the wound to minimize the risk of maceration. The dressings conform effectively to a variety of body contours to allow for a wide range of motion. Mepilex Border AG contains silver sulfate, which is an effective antimicrobial agent for wound care. In dry conditions, the silver sulfate is inactive, but when fluid is absorbed into the dressing, it comes in contact with silver sulfate, and silver ions are released into the wound fluid. Mepilex Border AG inactivates wound-related pathogens within 30 minutes and provides a sustained release for up to 7 days. Mepilex Border AG features a variety of sizes, including sacrum and postoperative configurations, which allow for a wide range of uses. Mepilex Border AG post-op sizes offer optimum post-surgical coverage and exudate management for a variety of surgical wounds. Mepilex Border Sacrum AG is a shaped sacral dressing with all of the benefits of Mepilex Border AG and SafeTac technology. It has an innovative center release system that makes the dressing easy and hassle-free to apply. The release paper is separated into 3 sections. Remove the middle one first and place the dressing on the patient. Then remove the 2 other release papers and smooth the dressing into place. Application of the dressing is fast and easy. All of our Mepilex Border AG dressings feature 5 layers of protection. The first layer is our SafeTac technology wound contact layer that minimizes patient pain and trauma upon removal. SafeTac technology adheres only to dry skin and not to the moist wound bed, sutures, or staples. SafeTac technology seals the wound and allows fluid to transfer into the dressing, which minimizes the risk of maceration. Layer 2 contains our unique compressed foam with silver that absorbs and spreads exudate while providing the antimicrobial power of silver. Layer 3 features our super absorbent layer that absorbs and stores exudate from the pad below, keeping it safely away from the wound and surrounding skin. Layer 4 is the non-woven layer that retains and spreads fluid for better vapor transmission. It has a distinct gray coloring to help you distinguish the AG version from our regular Mepilex border dressings. The fifth layer is a backing film that provides a barrier to moisture, viruses, and bacteria, and the film offers high permeability to allow effective moisture vapor transfer. Mepilex Border AG is designed for medium to high exuding wounds, such as leg and foot ulcers, pressure ulcers, partial thickness burns, traumatic and surgical wounds, where a moist environment, exudate management, gentle fixation, and antimicrobial action is indicated. You should not use Mepilex Border AG on patients with known sensitivity to silver. You should also not use Border AG during radiation treatment or examinations such as X-ray, ultrasound, or diathermy. Mepilex Border AG should also not be used with oxidizing agents such as hypochlorite solutions or hydrogen peroxide. Mepilex Border AG with SafeTac technology offers the unique combination of ease of use, maximum comfort for the patient, and of course the antimicrobial power of silver. There's no other wound dressing like it.
Pain at dressing changes is avoidable, which means stress and the delayed healing it causes is as well. Just use dressings with SafeTac. SafeTac is a unique and patented adhesive technology. Its formula has been refined over more than 20 years. No other adhesive can perform exactly the same way. SafeTac only sticks to dry skin, never to moisture, such as the open wound, and it spreads peel forces over a wider surface at removal. The diluted force isn't strong enough to strip skin cells, meaning less painful and damaging removal. It also adheres to dry skin instantly and can be taken off and repositioned without loss of effectiveness.
Monlica Healthcare offers a new wound contact layer dressing that provides undisturbed wound healing and minimizes trauma to the wound and pain to the patient upon removal. This is the new Mepitel One. Mepitel One is designed for a wide range of wounds, such as painful skin tears, abrasions, surgical incisions, partial thickness burns, traumatic wounds, blistering, lacerations, partial and full thickness grafts, radiation skin reactions, and leg and foot ulcers. It can also be used as a protective layer on non-exuding wounds and on areas with fragile skin. Mepitel One can be left in place for up to 14 days, depending on the condition of the wound, which reduces the necessity of frequent primary dressing changes. The porous structure of Mepitel One allows exudate to pass into an outer absorbent dressing. The SafeTac layer is on the wound contact side only. It prevents the outer dressing from sticking to the wound and ensures atraumatic dressing changes. The SafeTac layer also seals around the wound edges, preventing the exudate from leaking into the surrounding skin and thus minimizes the risk of maceration. In addition, Mepitel One does not leave residue on the skin or in the wound bed, and it conforms well to most body contours. Mepitel One is transparent for easy wound inspection during application and wear, and provides a low potential for skin irritation and allergy. To apply Mepitel One, clean the wound area and ensure peri-wound skin is dry. Remove one side of the release film and apply Mepitel One to the wound. Then remove second release film. Allow for at least 1 centimeter overlap of wound edges. Larger wounds may require more overlap. Apply an outer absorbent dressing and a retention dressing if needed. The absorbent dressing may be changed as needed, but Mepitel One may stay in place as recommended by the clinician, up to 14 days. Mepitel One, the newest addition to the Monlica Healthcare family of SafeTac products. The right and best choice for minimizing trauma and pain to the patient during dressing changes.
Humica designed 2 cordless battery-driven dermatomes, the D42 and the D80. The D42 is a small and lightweight battery-operated dermatome. Its maneuverability makes it an excellent tool in pediatric and general plastic surgery. It's very suitable for harvesting grafts from curved surfaces and also for primary excision. Furthermore, this dermatome is often used to harvest the 42mm or 1.65-inch wide graft that's required in Humica's Meek technique. The D80 dermatome was developed for more general use. It has a wider head than the D42 and a larger grip that holds a more powerful battery. The following sequences will present the handling of the Humica D42 and D80 dermatomes and show their applications. Both dermatomes hold powerful rechargeable batteries. To charge them, they are placed in a so-called charger support unit. The motor is put down on the support unit to keep it at hand and prevent it from loss. Before use, the autoclave case is opened and the dermatome and its accessories are taken out. The blade cover is closed and a sterile funnel is slid over the open end of the shaft. After connecting them, the non-sterile motor and battery are slid in the shaft, guided by marking lines, while the sterile funnel prevents contamination of the outer surface. When the cartridge is completely inserted in the shaft, the open end is closed with a rear cap. For safety reasons, the dermatome is provided with a locking mechanism that prevents accidental run. To insert a blade in the dermatome, the 2 locking buttons of the head are pressed and the blade cover is opened, thus offering access to the blade compartment. The Humica dermatome blade is precision grinded in a double facet shape for minimum resistance and smooth cutting. The blade is put in place and the cover is closed. The graft thickness is adjusted by means of an adjusting lever fixed at predetermined positions to prevent accidental change. The dermatome can be provided with a width-reducing clamp to limit the cutting width. Several clamps are available for both the D42 and the D80 dermatome. To check proper operation, the main switch is pressed. The dermatome is now ready for use. Here, a D42 dermatome is used to harvest a graft from the upper leg of a male adult patient. As an alternative for the use of manual devices like a Humvee or a silver knife, a D42 dermatome is very suitable for excision of wounds. After use, when motor and battery have been taken out, the blade is removed from the instrument. It's recommended to remove blood and tissue remnants shortly after use by rinsing with warm water and a soft brush or gauze. This pre-cleaning will prevent unnecessary corrosion of the instrument. For washing and sterilizing, the dermatome is placed in an autoclave case that can only hold the instrument after removal of motor and battery, thus preventing accidental sterilization of these parts.
All burn surgeons worldwide face the same problems in treating severe burn wounds, such as limited donor sites and difficulty in handling widely meshed skin grafts, especially when expansion ratios of 1:3 and higher are required. The expansion ratios of these mesh grafts are not as realistic because 25% to 40% is lost during meshing and handling. We're proud to be the exclusive supplier of the modified Meek technique, the solution to all of these problems. In the following sequences, we will present the surgical instruction procedure of this modified Meek technique. Here, the blade's axis is put down on the Meek machine. The bridge is placed over it and tightly secured. The unsterile motor should be encapsulated in the sterile housing by using the sterile funnel and using the black lines as guidelines. After sliding the motor into the housing, it's placed on the machine and secured with a clamp. The hose of the air supply is connected to the connector of the motor by means of a quick coupling. Required air pressure is 4 to 8 bar. Air supply is controlled by pressing the foot pedal completely down. Estimate the amount of skin you need to harvest. Please use the sheet Number of Meek gauzes required per percentage TBSA as a guide to indicate the amount of gauzes you need and therefore the amount of skin you need to harvest. A split thickness skin graft between 0.2 and 0.3 millimeters is often used for harvesting. It is recommended that the D42 is used, as its dimensions are specifically designed for the Meek technique. It is very important not to use oil or any other fatty substances during preparation of the donor site on the ward and during graft harvesting, because the oil prevents the glue from sticking the graft to the gauze. Make sure the cork plate is wet, but prevent the pre-folded gauze from getting wet. Spread the graft completely on a sterile surface. The epidermal side of the graft is placed down on this surface, and place the cork plate on the dermal side of the graft. Cut the graft to the exact size of the cork plate. After cutting, gently turn over the cork plates so the skin is in place and flat. An alternative could be to place the graft dermal side down directly on the cork plate. If needed, trim the graft to the exact size of the cork plate. Otherwise, excess skin will not be part of the cutting process, and therefore there is a lack of skin islands in this specific row. Always make sure that the dermal side is against the cork, so that you will end up placing the skin islands dermal side down on the wound bed. Place the cork plate on the dermal side of the skin. Then turn the cork plate over with the epidermal side on top. After cutting it twice, spray the epidermal side with glue. Then place the cork plate on the pre-folded gauze, taking care that it is lined up exactly on the central square of the gauze. After removing the cork plate and expansion, place the gauze with the dermal side of the skin on the wound bed. Leftover pieces of skin can also be used, therefore no skin is wasted. This is especially advantageous in case of extensive burns, where donor sites are scarce. Open the double block, and then place the skin into the cutting block and moisten the inside of the cover. Ensure that the cutting block is placed on the meek machine at the side of the hand wheel. For correct positioning, use the arrow indicator on the double block. Activate the motor of the motor-driven meek by pressing the foot pedal completely down. Simultaneously, rotate the hand wheel to move the cutting block under the bridge. Place the supported wedge on the double block and open the screws. Push it downwards while slightly lifting the cover. The graft will come loose from the cover, and open the cover. Make sure that each cork holder is rotated 90 degrees after the first cut, and pass through the machine again. Moisten the inside of the cover of the double block in between the cuttings. Always place a second cork plate in the other cork holder to facilitate optimal cutting of the graft. Check if the cut has been done twice by bending the cork plate gently. By cutting the cork plate twice, 196 individual skin islands have been created. Place the cork plates with the skin on a flat sterile surface that is covered with a sterile drape. Put the cork plates a certain distance from each other. Set the cork plates away from other items to prevent them getting sprayed as well. Spray the epidermal skin evenly with adhesive from a distance of 20 to 25 centimeters. Be careful that the force of the spray doesn't cause them to fly off the edge of the table. Be careful not to spray too much and allow adequate drying time of at least 6 minutes, but always wait until the surface changes from glossy to dull. Set a timer and make someone responsible for monitoring the time. After the required drying period, transfer the skin islands from the cork plate to the center of the sterile pre-folded gauze. Make sure the cork is placed in the center of the gauze. Press firmly with your thumbs. Leave the cork plates in place until the moment of transplantation. Always start at the zigzag side for the first expansion. Stretch completely. Then the second expansion on the plain side is to be done. Stretch this completely as well. Remove the aluminium foil starting from one of the corners. A maximum of 196 skin islands is expanded in a controlled and fixed way. After the usual wound bed preparation, the gauzes are placed onto the wound bed and secured with staples, making sure that there is good, even contact. Apply the gauze graft side down to the wound bed. Stretch the gauze, working corner to corner, and flatten it to ensure optimal contact between the skin graft and the wound bed. Secure with staples and fold back the edges of the gauze. Gauzes should be placed close to each other and aligned to prevent additional scarring in between each one. The permeable nylon gauze also acts as a carrier for the graft and also helps protect from shear. Gauzes can also be trimmed to fit difficult areas. The graft islands adhere very well to the gauzes, and handling them is very easy. This is in contrast to the trouble in the handling of some widely expanded mesh grafts. All graft islands are correctly orientated to the wound bed in a regular pattern. The distances between the islands are relatively small, as they are showing fast epithelialization rates. Local therapy, after the Meek technique, is normally no different from the therapy used when applying mesh grafts. In order to have the graft take well, the wound bed is kept moist with suitable outer dressings after transplantation. These outer dressings should not be changed for the first 48 hours. After this period, these outer dressings may be changed daily, but leave the Meek gauzes in place. The Meek gauzes should remain in situ for 6 to 14 days. To facilitate removal, 1% silver sulfadiazine cream, also known as SSD cream, may be put on the gauzes 1 day prior to removal. Remove the staples and gently peel off the gauze fabric, leaving the graft islands in situ on the wound bed. It is no problem if removal is delayed after day 6, as epithelialization continues. The Meek method is a practical and reliable technique for obtaining widely expanded autografts, especially in case of extensive burns. It is considered the most efficient method for dealing with the patient's skin.
Extracare Negative Pressure Wound Therapy System has developed a new NPWT dressing to help treat non-healing wounds on the toes and forefoot. This instructional video will outline how to apply the dressing properly. Clean and prepare the wound in accordance with facility protocol and allow to dry. Assess the wound size and type. Apply skin prep to the peri-wound skin around the wound and areas under the dressing adhesives. Remove the silicone strips from the packaging. Place the strips in a contiguous pattern around the foot proximal to the body from the wound bed. Make sure to remove the red backing. Use 2 side-by-side layers and overlap the edges to completely encircle the foot. Remove the 4 small rectangular pieces of non-woven dressing from the packaging. Place 1 piece in between each toe. Remove the large spoon-shaped pad from the packaging. Trim the circular portion of the dressing to cover and extend to the edges of the wound. Note that if the wound is on top of the foot, a piece of the dressing should be placed under the foot to prevent maceration. Place the circular portion of the dressing on the wound. Wrap the rectangular piece around to the top of the foot and trim the excess. For wounds between the toes, only the long rectangular piece of the dressing may be needed. Remove the film drape from the packaging and apply it over the foot by peeling back one side of the first layer. Then, have the patient step onto it so that the toes face the fold and the adhesive covers the gel strips located on the foot. Leave extra room at the tip of the toes to prevent tension on the toes. Remove the remaining side of the first layer and fold over the foot. After the foot is completely encased in the film, pat down around the edges to ensure a good seal. Carefully remove the second layer of the film backing once it is on the foot. Recheck to make sure all of the film is sealed securely around the foot. No trimming is necessary. Once applied, pinch a section of the film drape on top of the foot over the dressing pad. Cut a 2 centimeter hole in this location. Remove the suction bell from the packaging and remove the backing layers. Place the suction bell opening directly over the hole in the drape with the tubing at the desired angle. Remove the top portion of the backing layer from the suction bell skirt. Attach the connector tubing to the suction bell. Connect the tubing to the ExtraCare NPWT pump. Note that it is recommended that the excess drape should be positioned toward the top of the foot, and the dressing should be secured with a cover wrap and foot protection. Weight bearing is discouraged. Set the ExtraCare NPWT pump to the desired setting and begin treatment. Devon Medical Products ExtraCare 3600 Negative Pressure Wound Therapy Pump is a clinical-grade, portable, battery-powered device which may promote wound healing through the removal of wound exudates, infectious material, and tissue debris from the wound bed using continuous and/or intermittent negative pressure. This pump works with all Devon Medical Products ExtraCare all-in-one bandage dressings and foam kits. Our ExtraCare 3600 system comes equipped with a power adapter, a rail clamp, a 400cc canister, and a user manual. Dressings, foam kits, additional and various sized canisters, carrying cases, and other accessories are sold separately. Please follow along as we take you through the different steps on how to operate our ExtraCare 3600 pump. To turn on the ExtraCare 3600 pump, flip the power switch located on the back panel of the device. The screen will display the starting image and the system will complete a self-check. After the self-check, the device will display the standby screen. The ExtraCare 3600 has a default pressure of 125 millimeters of mercury. To change the pressure, press the up or down buttons. The pressure will change in increments of 5 millimeters of mercury with a range of 40 millimeters of mercury to 200 millimeters of mercury. By holding down the up or down button, the pressure will change continuously in 5 millimeters of mercury increments. To change the operating mode, press and hold the mode button until the mode icon changes. The ExtraCare 3600 can operate in continuous or intermittent mode. If operating in continuous mode, a solid line will be displayed on the screen and the device will operate at the pressure set by the user. If the device is operating in intermittent mode, a dashed line will be displayed on the screen and the ExtraCare 3600 will operate for 5 minutes at the set pressure, for 2 minutes at 20 millimeters of mercury, and then will repeat. The ExtraCare 3600 pump will automatically lock if the device is inactive for 3 minutes. If this occurs, pressing the buttons will illuminate the screen, but the settings will not change. To manually lock the device, press and hold the mode and start/stop buttons for 2 seconds. To unlock the device, press and hold the mode and start/stop buttons for 2 seconds. If an alarm sounds when the device is locked, the backlight to the screen will turn on and the alarm will display. To start or stop treatment, press the start/stop button for 2 seconds. A rail clamp is provided to hang the device if necessary. To use the rail clamp, insert the clamp board firmly into the socket located at the back of the device. Release the screw on the clamp to make space for the hanging media. Snap the clamp onto the hanging medium with the socket open facing the ground. Tighten the screw and make sure the clamp is secure. Do not hang objects such as clothes on the device. Our ExtraCare 3600 pump comes with error alarms to ensure safe operation and use. The canister installation error alarm will sound when the canister is not detected or installed incorrectly. The device will not operate. The LED light will flash yellow and the canister error symbol will appear on screen until the canister is properly installed. The high voltage error alarm will sound when there is a risk of voltage incompatibility. During operation, if the input voltage is greater than 16 volts when the device is being used with an adapter that is not recommended, the LED light will flash yellow and the adapter error symbol will appear on screen until the correct adapter is used. Failure to use the correct adapter may cause the fuse to blow out. Once there is less than 10% battery power remaining, an alarm will sound. The LED light will flash yellow and the low battery symbol will appear on screen. The pump will continue pumping until the battery is completely depleted. Plug in the ExtraCare 3600 into a wall outlet to allow it to charge and function at the same time. The ExtraCare 3600 will be fully charged after 5 hours. The canister error alarm will sound when the canister is full. The LED light will flash yellow and the canister full symbol will appear. The pump will shut off. Install a new canister to mediate the error and continue treatment. The leakage error alarm will sound if the pump is unable to reach 80% of the preset pressure after 5 minutes. The yellow LED will stay on constantly and the minor leakage error symbol will appear on screen. The pump will stay on. If the pump is unable to reach 50% of the preset pressure after 2 minutes of effort, the alarm will sound. The yellow LED will flash and the major leakage error symbol will appear on screen. The pump will remain on, but will power off after 10 minutes of continuous alarm. To mediate a leakage alarm, inspect for possible air leaks between the wound and the ExtraCare dressing, the ExtraCare dressing and canister, and the canister and pump. If necessary, power the device off and on to restart the system after adjustment. If there is a blockage in the tubing or the dressing, the alarm will sound. The yellow LED will flash and the blockage error symbol will appear on screen. The pump will continue to run. Replace with a new dressing and tubing set to remove the blockage. Devon Medical Products develops an exclusive line of advanced therapeutic medical devices for negative pressure wound therapy that is simple and effective for healthcare markets and patients worldwide. For more information, please contact us by email or phone at the information provided on screen. The ExtraCare Negative Pressure Wound Therapy System is used by healthcare professionals and caregivers to help treat non-healing wounds. Weighing only 8.6 ounces, the battery-operated ExtraCare pump was developed with portability and mobility in mind for patients. The device works with Devon Medical Products' proprietary anatomically fitted bandages. Our instructional video series demonstrates how to apply our bandages and how to use the ExtraCare system. Each ExtraCare comes equipped with one AC power cable, one 100cc canister, and a user manual. Bandages, additional canisters, carrying cases, and other accessories are sold separately. To use the pump, push the on-off switch to the on position. To set the pressure, hold down the vac button until you hear a beep. You will see a blinking number. To adjust the pressure, press the vac button. The pressure can range from 40 millimeters of mercury to 140 millimeters of mercury. Once it cycles to the prescribed pressure, press the pump button to confirm. To change the operating mode, hold down the mode button until you hear a beep. After the beep, press the mode button to change between continuous and intermittent mode. In the top right corner of the screen, you'll see a straight line indicating continuous mode or a dotted line indicating intermittent mode. Once the desired mode is selected, press the Pump button to confirm. To begin treatment, hold down the Pump button until you hear a beep. You will hear the pump begin to operate. Once the correct pressure level is achieved, the device will begin treatment. When there is less than 25% power remaining, the battery icon will flash and the alarm will sound once per minute. If the icon is flashing, it is recommended that the extra care be plugged in so that it can both operate and charge simultaneously. There are various potential sources of air leaks, including an incomplete seal between bandage and skin, improper connection between tubing, and/or canister leakage. For minor leaks, an alarm will sound and the system will shut down after 20 minutes. For major leaks, an alarm will sound and the system will shut down after 5 minutes. For pressure errors, if there is a difference of plus 10% or minus 2 millimeters of mercury for more than 1 minute, an alarm will sound and the LED light will illuminate. This is a small leak, but the pump will continue to run. For any of these errors, find the point of leakage and create the proper seal. When the liquid level in the canister is full, the liquid level probe will become short-circuited. The LED light will illuminate and the alarm will sound. The pump will power off immediately until the canister is changed. If the extra care is tilted more than 45 degrees for over 10 seconds, the device will sound an alarm and the red LED light will flash. If the device is tilted for more than 1 minute, it will stop operating. The system will not start up again until it is placed vertically for 3 seconds. If the canister is not detected or installed incorrectly, the extra care will not operate. The alarm will sound twice and the LED light will flash red, green, and yellow until a canister is installed properly. For more information or with questions, please email info@devonmedicalproducts.com. We
Result